Thank you so much for staying with us right here on WION World is One News, and welcome back. We're discussing the expectations from the union budget, and just before the break we spoke about the education sector and painted the lay of the land in terms of the expectations one has from the education system. Now the next big thing that we must discuss, and is a foundation stone of any country, is the healthcare sector. Now, no one can escape going to a hospital ever, and with the rising pollution levels, the hospital visits for many have increased. Despite several steps taken by the government of India to improve the healthcare sector, there are still severe roadblocks and many impediments that the common man has to undergo. Something as small as whether affordable healthcare is available to the common man is the biggest question which is plaguing the country. There are not enough Jan or Shadi stores in India as well. And is the health insurance scheme really working? That is another big question that we will be answering on the show. Is the budget allocation for the sector enough? This and more we will discuss with our experts, Ameera Shah, who is the Managing Director of Metropolis Healthcare Limited, and Sujatha, the former Secretary of Health and Family Welfare. Now, in the past 1 year, major legislations were introduced regarding the healthcare sector, but only one was passed by both the houses of the Parliament. What all has the government done regarding the healthcare sector? Our correspondent Shilpika brings you the story.
Despite the stops and starts in Parliament over the year, 2016 saw some key healthcare legislations moving forward. For starters, the Mental Health Care Bill 2013, which recognizes the rights of those suffering from mental illnesses, was cleared by the Rajya Sabha, which is the upper house of the Parliament. The House also passed amendments to the Maternity Benefit Act 1961, increasing the period of maternity leave from 12 weeks to 26 weeks and providing a host of other benefits. Unfortunately, these changes are not applicable to nearly 96% of working women who are employed in the unorganized sector. What's more, both these legislations are yet to be passed by the Lok Sabha, which is the lower house of Parliament. In fact, the only healthcare-related bill that was cleared by both houses of Parliament last year was the amendment to the Disability Act 1995. The amendments expanded the definition of disability to include 19 more conditions and increased reservations in government employment for disabled people from 3% to 4%. While Parliament remained gridlocked, the Union Cabinet in August 2016 cleared the Surrogacy Regulation Bill. The proposed law bans all commercial surrogacy but offers some caveats to support infertile Indian couples. Following that, in October, the Cabinet also cleared amendments to the HIV and AIDS Prevention and Control Bill 2014. The new bill puts the onus on the government to provide treatment only as far as possible, a term that has worried the nearly 2.1 million HIV-positive people in the country who depend on the government to provide free treatment for them for life. Both these bills are likely to be discussed in Parliament in 2017. Beyond legislative changes, among the biggest steps taken by the government when it comes to the healthcare sector was the decision to allow up to 74% foreign direct investment in pharmaceutical companies through the automatic route. However, this could threaten competition and cripple an industry that supplies low-cost generic drugs in the country. Also, in early 2016, despite opposition from tobacco farmers and the industry lobby, the government successfully enforced 85% of graphic health warnings on cigarette packets. With this, India has jumped in global rankings on size of tobacco pictorial warnings to the third position, having previously been at 136. Despite all these steps being taken, a major concern remains regarding the implementation of the National Health Policy. It was framed in 2015 and still remains a draft. The policy is yet to be cleared by the Cabinet. Bureau Report, WION.
Well, that was Shilpika painting the lay of the land as far as the healthcare sector in India is concerned. I'm being joined by two esteemed panelists on the show discussing the expectations from the union budget going forward. I've got Ameera Shah, Managing Director, Metropolis Healthcare, and I've got Sujatha Rao, the former Secretary of Health and Family Welfare of Government of India, discussing the healthcare sector. First up, let's go over to Ameera now. Ameera, we've discussed this many times in the past as well when we've spoken about how diagnosis is more important than prognosis. Metropolis Healthcare has a very large footprint. You're somebody who's redefining the paradigm of the diagnostic space in this country today, but you're a private player. Do you think that the common man today has access to affordable diagnosis in this country, which is far, far, far more important than the prognosis that the hospitals end up providing? Ameera, can you hear me? Are you with us? All right, we've lost the line to Ameera, so we will come back to Ameera in just about a bit. I'm going to go over to Sujatha Rao, who's the former Secretary of Health and Family Welfare of the Government of India. Sujatha, good evening. The Government of India, as we all know, is working on drafting a new national health policy and for planning a health assurance mission as well. Now, this opportunity has the potential to transform the health status of millions of Indians and achieve universal health coverage as well. Why is it that it still hangs fire?
Well, partly because, good evening to you also, and a Happy New Year. But you know, coming to your question, the reason why it hangs fire is that the whole system, the health system in India is very dysfunctional. We don't have enough supply. The supply side is not in consonance with the demand side. So as you increase coverage under insurance, the services are not available. And the ones who really suffer the most are the lowest two quintiles, who don't have access to healthcare services, not even of a minimal quality level. So till such time that we in India do step up capital infrastructure, investment in capital infrastructure, build up the health system, whether it's public or private, there are several districts where there's nothing of credible value in terms of service delivery. These insurance policies are going to have only a limited value to the people. That's the main reason why government is also wondering whether you can just have a budget that consists of paying up, subsidizing premiums without necessarily doing the appropriate investments for building up the infrastructure to provide the services.
Right, Sujatha. That was Sujatha joining us from Hyderabad. We also have our line patched on back with Ameera Shah, who's the Managing Director of Metropolis India, who's joining us live from Mumbai. Ameera, very good evening. Thank you so much for joining us right here on WION World is One News. Now, we've always discussed this, Ameera, that how diagnosis is more important than prognosis, and that's something that we've discussed many times in the past as well. You, as a private player in the diagnostic space, have really done a lot to change the paradigm of the way diagnosis is looked at in this country, giving it more importance than even the treatment. Do you think the common man, though, has access to affordable diagnosis, which is far more important than prognosis? Because private players come with certain level of price points in terms of their product offerings as well. But as far as the common man is concerned, does he have access to diagnostic facilities?
So, Chaiti, thanks for having me here. And I think it's so important that we're recognizing that diagnosis is such an important part of and the cornerstone of treatment, really. I think in the healthcare space, really, I would say India is broken up into multiple different markets. Even in the metro cities, you have branded healthcare players, hospitals and diagnostics, but majority of the metro poor actually don't have access because of affordability or lack of affordability to any of these services. Most of them land up using the government institute hospitals and lab services, and a lot of them land up using the unorganized sector. Now, unfortunately, in the unorganized sector, there is no government regulation at all, which basically means that anybody can do a pathology test. There is no checking, there is no minimum standard, and there is no monitoring of this. So you were lucky if you land up getting a good quality report, but it is definitely not a guarantee. To me, this is a big concern across India today, because out of 200,000 labs in the country, only 300 are accredited. And that too is a voluntary accreditation. Organizations like Metropolis, who have hundreds of labs in the country, we may follow global practices, but unfortunately that's not the norm. And unless you get a good quality report, you can't get the right treatment. And in rural India, of course, the situation is significantly worse. where there is just no access to good quality diagnostics.
Ameera, we've also noticed a lot of deaths that happen in this country purely because the diagnosis has been wrong, not because the prognosis has been wrong. What do you think the government needs to do to facilitate a proper access of diagnosis and properly penetrate into each and every part of the country so that we are able to save lives in India today?
Look, I think realistically, India is a large country, and I don't think we can expect our government to either provide or be the payer of all services. So I think therefore we definitely need an insurance scheme that makes diagnostics and treatment available and accessible and affordable for people across the country. That's number one. What our government can do is two things. One, initiate policy and minimum standards.
All right, we've lost the connection to Ameera right there. Ameera, do continue. We've got you back on.
So I think the one thing that government can do is to really implement good legislation, minimum standards for diagnostics, and making sure that only those labs that are meeting these diagnostic minimum standards are actually allowed to operate. And then the government must have a very rigorous enforcement of these standards. Today we often see in pathology called the sink test, where labs will take the sample, pour it down the sink and give a report. That is unacceptable in this country. It should be unacceptable. The second thing the government can do is to help make healthcare more affordable, is reduce all the import taxes, the customs duties that healthcare providers get charged, because that would allow us to cut costs and pass on those benefits to consumers as well.
Right, Ameera, stay with that thought. I'm going to come back to you in just about a bit. Now, I'm going to go over to Sujatha in Hyderabad. Now, Sujatha, last year the government gave a major fillip to Ayush Ministry. Did it have any huge impact on the healthcare situation of India? Do you think that particular program has really helped?
I don't think so. I think they are on the right lines to give some focus to the traditional medicines and Ayush sector, but it's too small. I mean, 98% is allopathy dependent, and so a lot more needs to be done. And also the emphasis has been on yoga and wellness, which is extremely good and important, but it'll take a long time for it to really get integrated with the overall system of treatment and care in our country. But I would like to just say, if you don't mind, what the earlier speaker said. I fully agree with her. I think she'll beautifully analyze the problem of diagnostics. But I only wonder whether, the entire portfolio, diagnostics, not only do we need to have good regulations and implement them, but we need to have protocols also to ensure that people are not overdiagnosed and we don't use unnecessary tests which are not required and expose patients.
No, ma'am, that's a different topic altogether as far as overdiagnosis is concerned. We're talking about the public sector really here, which requires diagnosis even to begin with before overdiagnosis really happens.
That's right. Yeah. So I agree with what she said. I just wanted to endorse that.
Sure. Okay, stay with us with that thought. Now, ahead of the union budget in India, one of the most popular and long-pending demands of the middle class of India has been to raise tax exemption limit on medical reimbursements. But at a larger level, there are also funding gaps in the government's public health programs as well. WION's Shelja Verma gets you the story.
25-year-old Rishika Karira is visiting the local hospital for a seasonal bout of cold, cough and mild fever. A doctor's consultation and medicines have set her back by 1,500 rupees. When Rishika moved to Delhi a few years back after getting a job at an MNC, the high pollution levels in the city took a toll on her immunity, and visits to the doctor and pharmacy have become more frequent. The software engineer has to submit these bills to her employer for medical reimbursement.
Usually, within 3-4 months, I end up spending 2,000 or 3,000 on a normal consultation charges. And if at all doctor prescribes some test, so they are normally 6,000-7,000 roughly on X-ray and bronchitis tests like that.
Since 1998, The income tax exemption limit for medical reimbursement is just 15,000 rupees per year. For senior citizens, the limit is 20,000 rupees.
Ever since that 15,000 limit was set almost 2 decades ago, the cost of medicines and hospitalization has only shot up. And given that it is not easy to get admission to a government hospital, middle-class Indians often have to rely on private health care, where private hospitals often insist that patients get their medicines from the in-house hospital pharmacies. And this only means one thing, that the medical expenses always will invariably cross the reimbursement limit.
Doctors, however, urge Indians to pay more attention to preventive health care and health insurance to cut down on medical expenses.
All of us who are relying on private health care would be best advised to have adequate health insurance, because disease prevention and proper treatment are the main factors. So it is useful that if one is going to be relying on private health care, one should be adequately insured.
The healthcare costs have risen up a lot during past some years. So I think this 15,000 limit should be risen up to like 20,000 or 25,000 at least from the tax exemption.
Even while raising the medical reimbursement limit has been a long-standing demand, there is a massive shortage of budgets allotted to India's public health programs. In 2015, an expert committee had observed that the government's tuberculosis control program is short of 750 crore rupees. With camera person Shavez Ahmed in New Delhi, I'm Shailaja Varma for WION.
All right, we're going to go over to our panelists now. Ameera, would you paint the lay of the land as far as investments are concerned in the Indian healthcare sector, and how welcoming are players like you, which are the private players, of investments coming in from abroad into the sector? And what is the government really doing to give a thrust to the right kind of investment coming in? Because also India is working on a cost arbitrage when it comes to medical and healthcare vis-a-vis the rest of the developed nations.
So I think at this point of time, I think private healthcare has actually seen a huge amount of investment in the past 10 years. I think we never had chains of hospitals. We definitely did not have chains of diagnostic centers like Metropolis. Now suddenly we have chain of eye care centers, dental centers, primary care centers, and so be it. I think all of this has happened because private equity companies globally have seen the opportunity in India. A lot of them think it's 1.2 billion people. They will need healthcare, good quality healthcare. And how can we invest in good firms that can scale and make this possible? I can't really say that the government has facilitated investment in a big way. I think they've been really neutral in the industry. They've neither played a positive role, neither a negative role in terms of investment into healthcare from international institutional investors. And I think honestly, while medical tourism is something that we like talking about in India, I would really feel like our first priority should be our own people. And our own citizens in this country, that we need to provide access and good healthcare services too. We ourselves at Metropolis provide services in 6 countries, but the focus is more about taking services to them in Africa and South Asia. And in India, we focus all our energies on our citizens and our people and making sure that we're giving them the best that they possibly can get. Every test that's available in the world, we provide in India, and every service that's not even provide in India, and I think that's something that healthcare we can be proud of.
Right, Ameera. I'm going to go over to Sujatha now. Sujatha, she mentioned about the common man really. Now, the health situation in India has improved significantly in the past few decades compared to what we saw as a base level just about a few decades ago. Now, policies have reduced the burden of communicable diseases in India as well. Still, the public expenditure remains low. This is impacting the common man's wallet. What do you really expect from the government of India in terms of a turnaround from the upcoming budget? And we'll wind the show with your closing thoughts.
I just hope and pray that the government of India increases its public investment from the stagnant 1.1% of GDP to at least 1.75 in the immediate short term, and utilize this money for increasing and strengthening the supply of services. See, as you would have seen in the NSSO, private sector is 3 times more, and we are not able to really cover the costs and ensure everyone for such expensive care, we have to invest on public sector, and moreover, in that we have to invest on primary care. The only way, I mean, the current policy of saying that you get sick and I'll insure you for treatment in a hospital is not sustainable. It's simply not sustainable. As we've seen in the US, insurance-led health system, which is hospital-based, is not the answer for India's wide disparities and poverty levels and low resource settings that we have. So public investment in health has to increase. It's not an option, and we have to focus on primary care and strengthening that space of the government in that space. So I think these are the two priorities that we need to do. Thailand has done it, Turkey has done it, Brazil has done it. You take any country that has successfully crossed the transition, this is the strategy they followed. We are following blindly what US has done, and you all know how the situation in the US is. 30 million people, after spending 20% of GDP, is still without access to health care. So, you know, we need to be mindful on these aspects of cost of care and who is benefiting from these insurance policies.
Sure.
It's certainly not the poorest. And I think it's time that the government does not renege from its duties to provide public goods to the people. That's it's fundamental duty, is duty bound to do.
Sure,
Health has to be human right.
Right, and you know, just to really give the government credit where it's due, there's an Equentis report which has come out that said that the healthcare sector in India will be growing at $158.2 billion in the year 2017. That gives it a 15% compounded annual growth rate on a year-on-year basis as well. I'd like to thank both our panelists for joining us today. Ameera Shah, the Managing Director of Metropolis Healthcare, and Sujatha Rao, former Secretary of Health and Family Welfare of the Government of India, to join us on the show on the Union Budget Special and the expectations that they have from the health